With heart disease being the leading cause of death in both men and women in the U.S., heart issues should never wait. Rapid response is critical when seconds count, and luckily we have world-class specialists at the forefront of advancing heart health right in our own backyard. Here with more on how cardiac rehabilitation can help heal hearts, our clinical dietitian, Sharon Smalling, and manager of cardiovascular and pulmonary rehabilitation with Memorial Hermann, Rhonda Leverton. Ladies, welcome to you both.
Thank you.
And this is really interesting. We were just chatting during the break. People talk about heart health. They think about a heart event and maybe surgery, the immediate aftermath. But let's talk about rehabilitation. What exactly is cardiac rehabilitation?
Cardiac rehabilitation is where we bring the patient after they've been out of the hospital for maybe about a week. And they get an order from the physician when they're in the hospital to come to cardiac rehab. So we're trying to help anybody that just about any kind of heart problem, and they've been in the hospital for either heart attack, stents, bypass surgery, transplant, anything. I mean.
So does that mean any patient who has experienced a cardiac event should be going into cardiac rehabilitation after?
Pretty much, yeah. There's a few things that they don't necessarily need it, but I don't think it hurts anyone because it's basically lifestyle changes.
And would they need like a referral or a recommendation to do that? Or this is something that the patient takes into their own hands?
They will have to have a physician's order if they would want their insurance to cover it.
A physician's order, okay, a critical component. Let's talk about what a cardiac rehab program typically includes.
Okay. A cardiac rehab program, when they first start, is that we give a very thorough and complete individual assessment to check out where they're at and what's gone on with them, so we know everything about them and we can do the best to take care of them. Then we take them and we put them in the program. We write a personalized exercise plan for them, and then we set goals. Sharon sees them shortly after that to help them with their diet. We have smoking cessation. We work on depression and anxiety, and
yeah, that's fantastic.
Yeah.
And the list of benefits on the screen, I mean, from nutrition to exercise to smoking cessation, as you mentioned, I mean, these are essentially components to build a healthier life. Let's talk about some of the benefits of cardiac rehab, because, I mean, not just lower blood pressure we're seeing on the screen, this is an entire list to improve your health moving forward.
Right. Right, I mean, you can see it's to help understand your medications. You know, we want patients to know why they're there. Yes, we want to help lower your blood pressure. We want to decrease your risk for the heart attack. And, you know, in decreasing your risk, my job is to help them take wherever they are nutrition-wise and move them to where they either want to be, where their goals might be, or where we see that they need to be to lower their blood pressure, decrease their weight, improve their cholesterol levels. Maybe, you know, I would say, I don't know, 50% of our patients have diabetes. Wow. A lot of those are out of control, so we're trying to get blood sugars under control as well, because that certainly increases your risk for heart disease. So all of those things combined, it sounds like a lot, and sometimes it is and can be overwhelming, but it is a 3-month program. So they come 3 times a week to exercise. I see them. I office in cardiac rehab, so they're in and out of my office all the time asking questions. It becomes a family. You know, we know them all very well by the end.
And you can help them get on a path to wellness. And I can imagine that a cardiac event is terrifying, right? It can be life-changing, but the silver lining here is that for a lot of the patients you see, this is a chance for them to reset and moving forward, live a better, healthier life.
I always tell them we're going to give them the power to take care of themselves, because then if they understand what they need to do and they understand why they're doing it, they're more likely to do it. So we're not going to be with them forever, so we just tell them the things that they need to know so they can understand what it is that they need to do to make themselves healthy.
And final thoughts just on nutrition. What are the areas for change that can make the biggest change, essentially, for heart health?
Well, you know, I always talk to them about what they're doing now, what they were doing prior to their heart attack, and look at those areas that are most important to change. How much sugar did you take in? How much fat did you take in? And try to move them more towards a plant-based diet, not eliminating meat, not eliminating sugars, not eliminating any food that you really love, but how can we make it so some of those things are not as large a part of your life, and we choose more of the healthier things, and to show them that they do taste good.
Yeah.
You know, sometimes they think if it tastes bad, it's going to taste bad if it's supposed to be good for you, and that's not true.
It's an excellent point. All
She's
right.
fabulous at what she does.
Sharon Smalling, Rhonda Leverton, thank you both for your time. Thanks for stopping
you.
by.
Thank you.
And in the meantime, if you would like more information, you can visit memorialherman.org/heart or call 713-222-2273.